Hello and welcome to yet another episode of Hair Talks by Terra Medical. My name is Dr. Joshua Chong, and today we'll be covering a different topic from usual. We're not talking about actual hair loss on the scalp. We'll be talking about the topic of eyebrow transplantation. So why would someone get an eyebrow transplantation? It actually involves us recreating the shape of an eyebrow that has been affected by loss due to scarring or due to insufficient growth from a young age or due to wanting a more desirable eyebrow shape or length or width or height. And the reason why we would perform this is because eyebrow transplantation is a permanent solution to eyebrow loss, whereas other cosmetic treatments or procedures that change the shape of the eyebrow, density, color, and shape and size will be temporary in effect. So if you're just curious or you're really considering eyebrow transplantation, what we're here to discuss is the ins and outs of how this would work in a hair transplant focused clinic like Terra Medical. It all starts with a detailed consultation. We would want to assess your eyebrows, including under high resolution microscopy, to see whether the skin is suitable for transplantation. We also want to understand your expectations, like what shape of eyebrows you want, what kind of density would be appropriate, how do we shape the eyebrows in a more natural appearance, and eyebrow shaping does differ from Asian populations to other races like Caucasian populations. We also want to assess how the donor appearance looks like, because eyebrows tend to have finer hairs, as you have noticed, and we want to see whether your donor has those fine hairs. They're usually located lower down in the donor region at the nape of the neck, and typically this is done using single or very maximally double grafts. And the process of harvesting would be discussed with the patient. Most cases will be done by using follicular unit excision and extraction, or FUEE techniques. We will select the good quality grafts from the donor area that's suitable, use a high-powered microscope to make sure that these grafts actually have good enough tissue, create the recipient sites to accommodate the grafts, and then implant the grafts both left and right equally. The average time taken to do an eyebrow transplant procedure depends on the number of grafts that are required. If let's say it were a small scar at the head of the eyebrow, this could be 50 to 100 grafts, or if we are reshaping the entire side of both eyebrows due to massive burns or scarring, could be up to 1,000 grafts of single hairs. One crucial part of how we go about discussing this eyebrow transplantation, a permanent procedure, with the patient is to discuss about the width and the height and take into other considerations the nose, the mouth, and how big or small your eyes are in planning the shape of the eyebrow. Of course, these other features can be augmented with other cosmetic procedures, but we are here to actually make sure that your eyebrows look nice, natural, and do not obscure or kind of overpower the other features on your face. There are a few general rules of thumb when we are planning the shape and the size of your eyebrow. The most important aspect of planning this design is the customer's expectation or the patient's expectation. What they want in terms of the shaping, the arc, and the length of the eyebrow takes much higher priority than what we think is going to be the best for them, because an unsatisfied patient at the end of an eyebrow transplant will require a touch-up procedure, and that involves additional downtime. Whereas if we kind of overdo it, let's say a little bit, all you need to do is just trim the excess bits away or tweeze them out or go for brow reshaping using threading or waxing methods. So getting a little bit more technical here, your eyebrow hairs are actually really horizontal to the skin. This is not like the hairs on your scalp where they come out at different angles, let's say 30 degrees in the frontal hairline and 45 degrees across the top of the scalp, maybe 30 degrees in the sideburns and temples. Whereas eyebrow hairs are really flat. We really want to plant them at maybe 15 degrees, 10 degrees angle and ensure that the curvature of the hair, where the hair exits the skin, is all in a natural and down-facing direction, so that when the hairs do grow out, which they will grow like donor hairs, a little bit longer than what your eyebrow hairs will grow and a little bit faster as well. You want to make sure that this growth looks completely natural and that there are no hairs that are pointing out in awkward directions. So apart from wanting your eyebrows to look better, A few other patient characteristics may be looking into an eyebrow transplantation procedure for better looks. And those will include patients that have had hypothyroidism and lost their eyebrows as a result, or have had burn injuries or congenitally deficient eyebrows, or just had a scar, maybe a small one due to a fall or a cut. These patients tend to benefit from having permanent hairs implanted into an area that's very receptive to hair transplantation. Some of the side effects that come with having an eyebrow transplantation include the risk of bruising, prolonged numbness, bleeding across the very obvious areas of the face. There will be some scabbing involved in the eyebrow region for about 7 to 10 days that will be visible. This bruising and the lighter kind of discolored areas of the bruise may persist even up to 14 days and may be hard to cover even with cosmetic coverage. But rest assured, all these downtime and temporary side effects would be over within 1 month at the very most. Most people take about 10 to 14 days to recover, and there are no long-term side effects. The other one downside to eyebrow transplantation is that the eyebrows will then take on a donor characteristic, at least the transplanted ones. So if you're only transplanting a portion of the eyebrow, that area needs to be trimmed regularly to make sure that they are congruent with the length of the rest of the eyebrows. And once you see these transplanted eyebrow grafts starting to grow, let's say 4 to 6 to 8 months down the road, and you see the density picking up, it'd be highly recommended that you get eyebrow shears. These are fixed length trimming scissors that help to shorten the eyebrows so that they don't grow too long and lengthy and kind of grow out of shape. And that's probably something that you would have to do if you underwent a full eyebrow transplantation, maybe at least once a week, because these donor hairs grow quite quickly. It's also safe after an eyebrow transplantation procedure to fill in the color with, for example, semi-permanent tattoos like microblading or eyebrow embroidery. So thank you for joining us for yet another episode of Hair Talks by Terra Medical, and I hope you enjoyed this one about eyebrow transplantation. Stay tuned to our channel, click like and subscribe, and leave any questions in the comment section below. We'll be delivering you with more hair loss and hair related content.